over the age of 20 have heart disease in some form. That's basically 1 in 2 people have some form of cardiovascular condition. So, kind of your health. And it is a silent killer. In many circumstances, sudden cardiac death is your first presentation of cardiovascular disease. And
oh, I'm 40 years old. I have a family history, and one of my family members just died. Do I go test? Is that a stupid thing to do? Everyone, this is Priya with On the Beat with Priya. I have my special guest. As I promised, I have Dr. Chandraprakasam, who's also the CEO of Trident Heart and Vascular. I do want to give the disclaimer before we go into the video. The information in this video is for general education and information purposes only, and it does not constitute to medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Like Dr. Chandraprakasam here, never disregard professional medical advice or delay in seeking it because of something you have read or seen in this video. If you think you have a medical emergency, call your doctor or 911. So, thank you so much, Dr. Chandraprakasam, for being here on the show. Thank you so much for taking time out of your busy schedule. I know February is Heart Month, and we're all very happy to have you here. Talk about heart health. I believe I've been promoting it loudly as to the top of my lungs as I can to gain attention for heart disease awareness. I loved the article that you wrote for Worthy Convos with the local. I just wanted, I know we wrote that in 2022, but I think a lot of the things that you say in that article is still very relevant. And I want to see if we can talk more about it. And I just want to hear from you as you explain to your patients so eloquently. Can you tell us a little bit more about why this Heart Health Month is so important? Why is it so important to raise awareness? And what should our patients be looking forward in risk assessment?
sure. First of all, thanks for having me on the show. It's it's uh, it's very important to recognize the dangers of cardiovascular disease. The statistics are certainly scary when you look at the fact that about 48% of the people over the age of 20 have heart disease in some form. That's basically 1 in 2 people have some form of cardiovascular condition. So that kind of explains why it is important to screen early and be on top of your health. And it is a silent killer, so it isn't present in the ways that we want it to all the times. Most of the times, or in many circumstances, sudden cardiac death is your first presentation of cardiovascular disease, and worldwide it accounts for about 17.5 million deaths on an annual basis. So the stakes are high. So when the stakes are high, we got to get our act together. So I think this is a month that we traditionally celebrate heart health, but I think, as you rightly pointed out, I think we should take care of it every single day and every single opportunity that's given to you. Again,
Of
thank you for
course.
having.
In Heart Health Awareness Month, Dr. Chandra, I wrote a little poem. It goes like this: Roses are red, violets are blue. Your arteries matter. Yes, I'm talking to you. Cupid shoots arrows, but plaques can too. And only one of those you can actually undo. So I know that you undo some of those plaques in the arteries. Can you tell me a little bit about the procedures that you do to help, or even risk assessments that, at different ages? At 20, am I at risk? At 30, am I at risk? Or at 40, when do I actually, like, someone asked me the other day, oh, I'm 40 years old, I have a family history, and one of my family members just died. Do I go test? Is that a stupid thing to do?
I think let's just break it down to parts, and I'll try to address each one of the questions that you had. So, age is important, but it is not an exclusion criteria to say somebody does not have heart disease. I think you have to assess the individual as an individual and assess their risk, and then decide what type of cardiovascular screening they need. The screening for different cardiovascular conditions depends on what you're looking for. Is it congenital heart disease, or is it structural heart disease, or coronary artery disease, hypertension related heart disease? So, really, there is no one size fits all screening program. I would say the answer depends on who you're looking at and what their circumstances are and what their symptoms are and what they want to be screened for. As far as risk factors are concerned, traditionally we've always looked at high blood pressure, high cholesterol, high blood sugar, which is basically your diabetes, increased waist circumference, which is basically your overweight and obesity, and smoking and excessive alcohol. But there are a lot of non-traditional risk factors which have come to the for because of how they've impacted our risk on a day-to-day basis. For example, sleep disorders, stress, chronic stress, other inflammatory problems like lupus, Crohn's disease, ulcerative colitis, chronic inflammation, and metabolic syndrome. So all of these things, and if you're from South Asia, like where I am from, originally, your risk automatically goes up just based on your ethnicity. So the risk factors are there. It's important to identify and take care of them before they strike. So now I'm going to come to your first questions about what we do is largely preventative. And of course, when you can prevent them and it gets to a point where you end up having a heart attack or a stroke, yes, of course, we can take care of a lot of those problems. But I think, in my humble and professional opinion, I think prevention should be the goal, and prevention should be the first strategy that we all should adopt, if that answers all of your questions.
Yeah, can you name some, like I've heard people say, "Oh, with can I just go get a calcium score? Do I really need to go to my primary care for this? Let me just see what that looks like, and if calcium score it says it's normal, maybe I don't have to worry about this." Is that a misconception, doctor?
No, I don't think it's a misconception, but I think it's important to get to the basics of knowing your numbers. I think, if you
Okay.
look at the cardiovascular health, I call it the life's simple seven. That's what we mentioned in our article. So, physically being active, checking your blood pressure, getting your cholesterol checked, getting your blood glucose or A1C checked, having your weight and your body mass index and your waist circumference checked, counting your calories, not smoking. So these are simple, practical, measurable things that you can do on a day to day basis. Now, when you're talking about more advanced screening, there are different ways of getting screened for cardiovascular disease. There is image based screening, there is stress tests, there is calcium score, like you mentioned. So, again, it is not a one size fits all approach. You will have to assess the patient individually, look at their risk factors, look at their symptoms, look at their family history, and then make an appropriate decision for what exactly this patient will need. But regardless, like I said, these metrics of having to monitor your numbers, leading an active lifestyle, taking care of your risk factors, I think will help you regardless of whether you have heart disease or not.
Okay. Can you give us a few tips of how we can change in lifestyle for someone who for a mom who's a busy mom who wears a hat all day around doing everything for her family? What are the small measures that she can change in her day to day? For example, 40-year-old mom with hypertension and hyperlipidemia, how can she change one small change that you usually tell your patients that she can do to
So
live a longer, fuller life for her kids?
I think it's just not applicable to a mom who's 40 and has kids. I think, I'd say this to any patient walking into the clinic and say, hey, you know, when was the last time you counted your steps? We all think 10,000 steps is an important milestone, but even if you get 5,000 steps a day, 6,000 steps a day, maybe 7,000, I think you're making an impact. I'd say make small changes, small steps. One positive thing leads to another positive thing. So more often, and watch what you're eating. I think simple steps again. Start with making one small change in your diet. Maybe, you've decided to start cooking at home, avoiding deep fried foods. I think that's a change. So I think for everybody, this counts, not just the busy mom or a busy dad or a professional or anybody for that matter, I think these lifestyle choices matter, and it is important to adopt these changes. I call them lifestyle because these changes have to be lifelong and not just short term.
So are these lifestyle changes alone enough? Can I take statins and medications, or can they go together hand in hand and work together?
I think they go hand in hand. I think, regardless of what medication somebody is on or not, I think these lifestyle modification basically forms your foundation or pillars of your cardiovascular health. There's no substitute for these things. There are substitutes for medications, but unfortunately, if you don't follow these things, no matter what you do with your medications, they're not likely to be fully successful, or your outcomes are not going to be the same as much as you would have when you follow these simple principles. And I call it the ABCDFs of cardiovascular health: avoid smoking, watch your blood pressure, count your steps, be in a desirable body weight, eliminate your risk factors, eat a lot of fruits, fiber, fat that are good fats, fatty acids, omega fatty acids. I think if you follow some of these things, I think you're making a substantial impact on your cardiovascular health. And I think medications are subject to the individual again. You need to talk with your provider, you need to talk with your physician to really decide what's appropriate for you.
Right. Thank you so much, Dr. Chandraprakasam, for telling us about all of these tips. I am definitely going to make sure I start counting my steps, which I have not been, I won't lie. And I'll make sure I watch what I eat as well. Um, the other thing was, I'm eating a healthy diet. My diet's great. I'm eating plenty of salmon. One drink a day is fine. I don't have to worry about this. I don't have to look at my numbers. When do you actually say, okay, it's time? How do I set this appointment? Where can I come find you? Where can I come see you and seek the help?
So I think for most people, their screening starts at their pre-CP or their primary care's office. I think, like I said, that's why they call your primary care. They are your primary care, primary contact, point of contact. So I think if you are somebody that has risk factors, or if you have somebody that has a strong family history, I think you should start with your primary care doctor. And I think if you're 20 years or older, if you are in a situation where you have all of these risk factors, it's reasonable to get started with your primary care, get your labs done, and I think your primary care should be able to appropriately address them. And if they feel it's time for you to see a specialist because of the risk factors or the symptoms or the abnormal findings on the screening test, yes, you will have the opportunity to meet with a cardiologist, go over your risk, and then decide on the appropriate testing. Of course, we are in the Southwest Medical District, located on 5801 Oak Bend Trail, Suite 250. We have an excellent team that takes care of all varieties of cardiovascular disease, both general and preventative, interventional, and um, I think it's important to start with screening and meet with your provider and have an honest discussion about your cardiovascular health. If you haven't done that, I think it's probably time to do it.
Thank you so much for explaining everything so beautifully. Thank you for your time and your knowledge. I look forward to, if I'm sure our viewers who are watching this are going to have more questions, and I hope to have you on the show again to answer some of those questions. So thank you for your time and have a great day. Thank you, Dr. Chandra.
Thank you so much for having me. You have a great day. Bye.
Thank you. Thank you.